Phlebotomy exam prep course. Question 1. A specimen should be transported to the lab. Option A, at the end of the shift. Option B, as soon as properly labeled. Option C, only at morning rounds. Option D, after refrigeration. The correct answer is option B, as soon as properly labeled. Specimens should be transported to the laboratory immediately after proper labeling to minimize preanalytical degradation. Delays can cause cellular metabolism, evaporation, and analyte breakdown, particularly critical for glucose, potassium, and coagulation tests. Question 2. Which lab test is sensitive to delayed processing? Option A, potassium. Option B, sodium. Option C, blood culture. Option D, glucose. The correct answer is option A, potassium. Potassium is highly sensitive to delayed processing because RBC metabolism and cell lysis after collection release intracellular potassium into the plasma, falsely elevating results. Specimens for potassium must be centrifuged and separated promptly. Question 3. Which is the recommended antiseptic for blood alcohol testing? Option A, alcohol. Option B, chlorhexidine. Option C, iodine. Option D, soap and water. The correct answer is option B, chlorhexidine. Isopropyl or ethyl alcohol must never be used to clean the site for blood alcohol testing, as it could contaminate the specimen and falsely elevate results. Benzalkonium chloride or chlorhexidine without alcohol are the appropriate antiseptics for this purpose. Question 4. A phlebotomist notices petechiae on a patient's arm. This may indicate: option A, normal finding. Option B, fragile capillaries or platelet disorder. Option C, allergic reaction to tourniquet. Option D, dehydration. The correct answer is option B, fragile capillaries or platelet disorder. Petechiae, small pinpoint hemorrhages under the skin, indicate capillary fragility, thrombocytopenia, or platelet dysfunction. They can also appear when a tourniquet is applied too tightly or for too long. The finding must be documented and the phlebotomist should proceed with caution. Question 5. Reflux of anticoagulant into a patient's vein may cause: option A, hematoma. Option B, infection. Option C, tissue necrosis. Option D, vision loss. The correct answer is option A, hematoma. Anticoagulant reflux can cause adverse reactions including hematoma formation and, in rare cases, systemic complications. To prevent reflux, the patient's arm should be kept in a downward position and tubes should be filled from the bottom up during collection. Question 6. Which is most important before performing venipuncture? Option A, confirm patient identity. Option B, tourniquet application. Option C, tube selection. Option D, site cleansing. The correct answer is option A, confirm patient identity. Patient identity verification using two identifiers is the single most critical safety step before any specimen collection procedure. Collecting from the wrong patient is a catastrophic error with potentially fatal consequences. All other steps follow identity confirmation. Question 7. If a patient faints during venipuncture, the phlebotomist should: option A, ignore the patient. Option B, remove needle and assist patient. Option C, continue draw. Option D, leave patient alone. The correct answer is option B, remove needle and assist patient. If syncope occurs, the needle must be immediately and safely removed to prevent injury, and the patient should be assisted into a safe recumbent position. Continuing the draw or leaving the patient unattended are serious safety violations. Question 8. Which additive is found in grey top tubes? Option A, sodium fluoride and potassium oxalate. Option B, DDTA. Option C, heparin. Option D, citrate. The correct answer is option A, sodium fluoride and potassium oxalate. Grey top tubes contain sodium fluoride, a glycolytic inhibitor that preserves glucose, and potassium oxalate, a calcium chelator that prevents clotting. This combination makes them ideal for glucose and lactate testing where metabolic degradation must be halted. Question 9. Phlebotomy should not be performed on: option A, arm with 4. Option B, non-dominant arm. Option C, forearm vein. Option D, hand vein. The correct answer is option A, arm with 4. Venipuncture should be avoided on an arm with an active 4 line because for fluids dilute the sample and compromise test accuracy. The non-dominant arm, forearm veins, and hand veins are all acceptable collection sites under appropriate circumstances. Question 10. A blood culture should be collected in an order before. Option A, EDTA tubes. Option B, serum tubes. Option C, heparin tubes. Option D, glucose tubes. The correct answer is option A, EDTA tubes. Blood cultures must be collected first in the order of draw to minimize the risk of contamination from skin organisms and to prevent carryover of additives from other tubes. EDTA, heparin, and other additive tubes follow after blood cultures. Question 11. Which is a potential preanalytical error? Option A, incorrect patient ID. Option B, analytical machine calibration. Option C, lab report formatting. Option D, staff scheduling. The correct answer is option A, incorrect patient ID. Preanalytical errors occur before the specimen reaches the analyzer and include incorrect patient identification, wrong tube, improper collection technique, and mislabeling. Analytical errors occur during testing, machine calibration and report formatting fall into analytical and post-analytical phases. Question 12. Which is true about using evacuated tubes? Option A, remove cap before insertion. Option B, push tube into holder. Option C, tube fills automatically by vacuum. Option D, requires syringe. The correct answer is option C, tube fills automatically by vacuum. Evacuated tubes fill automatically when inserted into the holder and the needle enters the vein. The preset vacuum draws blood into the tube without manual aspiration. Caps must not be removed before insertion as this destroys the vacuum and prevents filling. Question 13. What is the first step in routine phlebotomy procedure? Option A, wash hands. Option B, prepare tubes. Option C, apply tourniquet. Option D, identify vein. The correct answer is option A, wash hands. Hand washing is the absolute first step in the phlebotomy procedure and is required before patient contact, equipment preparation, or any other action. It is the most effective measure against healthcare-associated infection transmission. Question 14. A light mix sample appears. Option A, clear. Option B, milky. Option C, dark red. Option D, yellow. The correct answer is option B, milky. Lightmia produces a turbid, milky white or cream appearance in plasma or serum due to elevated triglycerides and chylomicrons, typically from a non-fasting state. Yellow appearance indicates icterus, while dark red or pink indicates hemolysis. Question 15. Why is it important to invert anticoagulant tubes gently? Option A, mix additive without hemolysis. Option B, warm sample. Option C, sediment cells. Option D, activate clotting. The correct answer is option A, mix additive without hemolysis. Gentle inversion, 8 to 10 times, ensures complete mixing of the anticoagulant with blood to prevent clotting while avoiding the mechanical trauma of vigorous shaking, which lyses red blood cells and causes hemolysis that invalidates many laboratory tests. Question 16. Airborne pathogens require what level of precaution? Option A, contact. Option B, droplet. Option C, airborne isolation. Option D, standard only. The correct answer is option C, airborne isolation. Airborne isolation precautions are required for pathogens like Mycobacterium tuberculosis, measles, and varicella that are transmitted via small particle aerosols. This requires N95 respirators and negative pressure isolation rooms, a higher level than droplet or standard precautions. Question 17. The phlebotomist should collect a specimen for glucose analysis. Option A, after eating. Option B, with no fasting. Option C, according to physician order. Option D, always in the evening. The correct answer is option C, according to physician order. Glucose specimen collection should always follow the physician's order, which may specify fasting, random, 2 are postprandial, or timed draws. No blanket rule applies. Collecting without following the order can lead to clinically misleading results. Question 18. For proper specimen identification, labels should include: Option A, patient name, ID number, date/time. Option B, only patient name. Option C, only date. Option D, only test type. The correct answer is option A, patient name, ID number, date/time. Complete specimen labeling requires at minimum the patient's full name, unique identifier, medical record number or DOB, date and time of collection, and collector initials. Incomplete labeling is a critical error that can result in specimen rejection or patient misidentification. Question 19. The antiseptic used for blood culture site preparation is: Option A, alcohol only. Option B, iodine or chlorhexidine. Option C, saline. Option D, hydrogen peroxide. The correct answer is option B, iodine or chlorhexidine. Blood culture collection requires rigorous antiseptic preparation using povidone iodine or chlorhexidine gluconate to minimize contamination risk. Alcohol alone is insufficient for blood cultures due to its limited activity against skin flora in deeper layers. Question 20. Which is the most common site for routine adult venipuncture? Option A, median cubital vein. Option B, radial artery. Option C, dorsal hand vein. Option D, femoral vein. The correct answer is option A, median cubital vein. The median cubital vein in the antecubital fossa is the preferred site for routine adult venipuncture due to its large size, superficial location, and minimal proximity to major nerves and arteries. The radial is an artery, femoral is an emergency-only site.